how did you end up being a preventative neurologist?
A preventive neurologist of one of only like two. Just thinking about diseases that rob you of that sense of who you are. The thought that there's nothing that we can do for people just didn't sit well with me.
What age do you believe we should start thinking about preventative measures?
People listening to this are at risk. Prevention is for everyone.
And what is the relationship between these diseases and mental health?
There absolutely is one. Depression is a risk factor for Parkinson's, for Alzheimer's disease.
The thing you're most proud of with the work you're doing?
That I'm actually pioneering a space for people to control the future of their brain health.
Sister.
Yeah.
Sister. I'm so excited to be with you.
I am pumped. I cannot wait to talk about this.
So I was thinking about this because we had a phone call. Was it like 3 years ago?
Even longer.
Really?
It was like, yeah, I was at Cornell, so it was four years ago.
So for listeners, we went to the same school. We were in the same sorority. Kellyann was a year older than me, but it's like a small sorority. Like, you know everyone.
Yes.
It was like 18 to 20 people a pledge class, like very tiny. And then I don't think we had spoken since graduation, probably.
No.
And was it Laura that reached out to me?
Yes.
I remember messaged me or texted me being like, would you be willing to chat with Kellyann? And I was like, of course. Like, tell me more. We connected. And now I feel like I have, ever since that call, you know when you reconnect with someone or you learn something new and then it's like you're seeing them everywhere?
Yeah.
That's how I felt about you. I feel like every time I turned around, it was like, Kellyann. I was like, okay,
I'm like
now
blushing.
I got to see you as a patient and get you on the show.
Yeah, so I vividly remember that, and we'll get into this more, but
Yeah.
I was someone that was trying to pioneer a space that didn't exist.
Mm-hmm.
And, shout out to our awesome sorority sisters. Laura's always been my sounding board, and Alexa also always having my back, and just brainstorming ideas about how to really increase accessibility and knowledge around the work that I'm doing and get more people aware about what the heck preventive neurology is. And then your name came up and Laura's like, we have to make this happen. Like, this is perfect. We got to do it. So I'm grateful for you for taking that time.
I'm honored.
And now here we are.
Look at us. I'm so excited because what you're doing is work that I'm very interested in personally, given my history and my current relationship with my health. And my brain has been something that I have felt super, I think, protective over ever since my concussions. Like, there was definite PTSD after my car accident where I felt severely protective over my head and really triggered by things and really frustrated by things. And so when I feel like, especially in postpartum, I don't have that word recall, or I'm struggling with my memory, or I feel like it's not wiring or firing in the way that it's supposed to, it immediately sends me into my health anxiety around my head. And it's such a specific thing that I'm anxious over. And I know I said this to you. It was even like my intrusive thoughts around my first son were all related to brain trauma. It's very odd. But I am so deeply interested in the space, and as someone whose grandfather had Alzheimer's, and, we'll get into it all. But what led you into this space? Like, how did you end up being a preventative neurologist?
Yeah, and a preventive neurologist of one of only two.
Right?
I've always been interested in prevention, period, and thinking about ways, both lifestyle and pharmacological, non-pharmacological ways that we can optimize our health from an earlier age. And in medical school, I was really struck by how algorithmic medicine was. It was like, okay, you have X symptoms, so therefore the treatment is X, and then goodbye. Mm-hmm. And no one really thought, well, why is this person having X? Or what can we do to prevent this person from having X? And I remember sitting through this lecture of a surgeon who left the field and went the other direction in terms of working with patients who had cardiovascular disease, heart disease, and putting them on specific diets or regimens in terms of exercise and optimizing their sleep. And he was showing how he made really miraculous improvements in their cardiovascular disease risk. And that was really what led me down this path of like, well, what other diseases are potentially reversible? I love the brain, but neurology has always been so fascinating. It controls you, like everything about you, your personality, the way that you move. Like, it is just the key organ. I'm biased, of course, but without the brain, like, what is the point of life? Just thinking about diseases that rob you of that sense of who you are, like dementia, just completely takes away all of your memories. It takes away your sense of self. The thought that there's nothing that we can do for people to address a disease like that just didn't sit well with me.
Yeah, it's heartbreaking to watch someone go through that. As we watched it with my grandpa, it's just really hard.
So I really, really fell in love with neurology in medical school when I was seeing a lot of these patients who were so impaired, and just thinking about like, wow, how is their brain functioning like that? Like, where is this person that once was, super successful, super charismatic, is now just a completely different person? How did this happen? I did so much research. I fell down so many different rabbit holes, and I eventually found one person who was working kind of in this space. He was doing dementia prevention at Cornell, and I cold reached out to him and I was like, hey, I think the work you're doing is awesome. Can I come spend some time with you? And I did, and kind of the rest is history there. He had me come in and do an away rotation. I applied for a residency at Cornell, and I stayed there, and I landed my dream job eventually managing the Alzheimer's prevention clinic there. And I really think back to those times because I thought it was my dream job, but I had these really uncomfortable feelings that were really bubbling up during my time in academics. And it really led me down a totally different career path. I thought what I wanted to do was stay and publish and write grants, and there were these pressures to start seeing patients that had clinical diagnoses instead of working in prevention, because unfortunately there really are no billing codes for preventive neurology services. It's a brand new field despite the astronomical demand and need. There's no way to really, in our current healthcare situation with our current insurance reimbursements, there's no way to really profit for the hospital off of that type of care. So there was a lot of pressure for me to practice medicine that really wasn't aligned with my goals. And then there were like colleagues making subtle jabs about what I did, like, oh, you see patients and you tell them to eat blueberries. And I'm thinking like, yeah, and also like, let's talk about their ApoE4 gene and their lipid subparticles and their imaging biomarkers. But yeah, like, let's just go with blueberries.
Let's narrow down to the blueberries.
Yeah.
Unfortunately, I feel like that's the dismissive nature of a young female looking to do something different that she believes in.
Totally.
But now you run your own practice.
Well, the story gets a little bit more complicated. So, at the time with all these pressures, I also was presented this amazing opportunity to work at a leading longevity medicine practice. And I made a very difficult decision at the time to take that opportunity, and it was wonderful. I learned a ton. I had amazing mentorship, but after 2.5 years, again, these uneasy feelings started bubbling up. And at that time, I think my husband was about to lose it on me. He's so supportive and amazing in every way, but he and many other people, aside from our lovely sorority sisters, of course, just didn't really understand that it wasn't necessarily just a job for me. My professional career is my passion, and it gives me really a sense of purpose. And I started to feel really boxed in again, and a loss of autonomy. And I felt like I couldn't push the field forward the way that I really wanted to. So I did it again.
Oops, I did it again.
And I quit. But this time it was way more terrifying because I didn't quit to go into something
Right.
else that was already laid out. I had no roadmap, no salary. I had an amazing salary before. I had none of that. I just had some savings and my own dream that preventive neurology is going to be a field, and I have to be the one that pushes it forward.
Go girl.
So
'Cause
here I
you
am.
will, and it will be. So preventive neurology, what are you working to prevent?
Yes. So it's a broad term, but my particular niche in it is diseases like Alzheimer's, Parkinson's disease, Lewy body dementia. Those are what we call neurodegenerative diseases.
Okay. Can you actually explain the difference between the three? Because I'm familiar with their names, minus Lewy body,
Yeah.
but I don't know if I'd be able to actually say what the difference is.
Yeah. So, in most basic terms, these diseases are really defined by clinical symptoms and pathological features, meaning what we see on brain imaging, or if we do an autopsy after someone passes away, what their brain tissue actually looks like. But in the most general sense, Alzheimer's disease is primarily a memory problem. People will have issues usually with short-term memory. They'll get lost. They can have some behavioral problems and behavioral changes, more agitation. Lewy body dementia, or let's start with Parkinson's. Parkinson's is more of a movement problem. People will have tremors or shakiness of the hands usually, but also could be the legs or other body parts. Stiffness in their muscles. They'll have really slow, shuffling movements. And then Lewy body dementia is kind of this in between. You have memory issues, a lot of visual spatial issues, meaning people will have difficulty judging depth perception or constructing things. You'll also have these movement issues, and people can have hallucinations. They can be very tired. The world really views them as very separate entities, and of course they are separate, but there's also a lot of overlap, and the beauty of preventive neurology is that they share so many common risk factors. So thinking about prevention really requires you to blur the lines between these neurodegenerative diseases and view them more on a spectrum, because they're really the same things are driving the processes a lot of the times. And if we can address those earlier on, we can do something to delay or hopefully even prevent the onset of them.
So when are most people, obviously there's no set number, and I'm really sorry if you're hearing sirens in the background, we're just working with what we've got, but what age are most people experiencing these things for the first time?
Symptoms,
Yes.
you mean? Parkinson's usually in their 50s. Alzheimer's, most cases start after 65, and the same is true for Lewy body dementia.
And what age do you believe we should start thinking about preventative measures?
So this is why it's so important, because people listening to this are at risk, and they could have early pathological changes happening right now. These diseases start 30 years before the first obvious symptom presents. So that means in your 30s and 40s, that's the time to start caring, not when symptoms have started.
And and we're going to get into the testing, but if you are someone who is at risk, are there ways, and I don't know if you've been doing this for long enough to have the data, so this might just be a potential answer down the road, but are there ways that you can legitimately prevent the onset of symptoms, or is it more like let's just get ahead of it to make it a better case scenario?
I truly believe there are things that you can do to prevent the onset of disease. Those studies are so challenging to design because they require a ton of money. They have to happen over 30 years.
Right.
So we will have more information about that. That's one of the things that I'm studying with now the emergence of these cool new blood tests that can detect disease pathology earlier on. We'll have those answers, but I really believe that you can prevent disease if addressed early.
Okay, so let's get into the testing, because you were fortunate, or I was fortunate enough to experience this testing with you, because A, I wanted to do it for myself, but B, I thought it would be fun to experience before the interview so we could kind of go over it. So step one is this sniff test, which was one of the crazier things because the scents were so strong.
Yeah.
So basically I got these booklets from you, and I can share all this, right?
Yeah.
Okay. And I scratch off, it's like a scratch and sniff sticker kind of. And I scratch it and sniff it, and then I had to mark which one it smelled the most like of the 4 or 5 options.
Yeah.
And they were so strong. And some were delicious and some were horrific, like gas or something.
Yes.
Oil, like
Petroleum,
yes. And then I sent you what I thought everything was. We did a blood test, and then we did a lengthy cognitive test. So I'm curious, let's start with the sniff test. Why is that a part of it? Like, what are you looking for there with the sniff test?
Yeah. So this is so cool, but one of the earliest signs of a neurodegenerative process, Parkinson's, Lewy body, Alzheimer's, is loss of sense of smell. This can happen 20 to 30 years before.
Wow.
Some even say 40 years before. So our odor detection is actually a cranial nerve, meaning a nerve that comes right from the brain. And there's this thought that in some instances, the disease pathology actually travels up the olfactory nerve or the smell nerve towards the brain. We don't know if that's exactly true, but it does seem to be one of the first areas of the nervous system that's impacted. So it turns out to be a pretty interesting marker. Now, there are other things that can cause you to lose your sense of smell. So concussions are a really common one, especially if that concussion involved direct trauma to the nose, because those the nerves there are really sensitive and it's easy to tear them and damage them. COVID, of course, we know can cause loss of sense of smell. If you have a lot of sinus issues or have had any sort of surgery there, it can impact it. So the best way to use it is longitudinally to test, especially when you're young, and then to follow it over time to see if there are really any changes. And unfortunately, our brain is kind of a jerk because you'll lose your ability to detect the pleasant odors before you lose your ability to detect the really nasty ones.
So we do the sniff test, and then we do blood work, and it's a pretty extensive blood panel. What are you guys looking for within the blood panel that would potentially be like, oh, you are at high risk?
Yeah. So it's hard to say like, oh, you're at high risk, but I'll say you're at risk. Yeah, we'll say you're at risk. So one of the first things that's important and I really advocate for testing is a specific gene called ApoE. There are 3 different forms of this gene, and the one form called ApoE4 in particular is linked to a higher risk of both Alzheimer's and Lewy body dementia. And the reason I think this gene is so important is because it's extremely modifiable. We understand a lot about how this gene can contribute to neurodegenerative disease. It's involved with cholesterol, and we can address it in a way to hopefully get people off the path of disease. And it just changes what I recommend. So for you, for example,
we can share.
Okay, so you have the normal variant in this gene, which is called ApoE33. That's not associated with an increased risk directly of Alzheimer's or Lewy body, but we do know that people with this gene can and still do get neurodegenerative diseases. It just probably follows a different pathway. But it changed the way that I treated, for example, your omega-3 levels. You needed a different type of omega-3 than someone who maybe had that ApoE4 gene, because people with that gene just process omega-4 or omega-3s differently. So that's just one example of kind of how that really helps us personalize our care.
And you mentioned cholesterol, and I'm obviously curious because that was something that we discussed a lot with my blood results. How is the ApoE4 gene also connected with cholesterol?
Yeah, so people with the ApoE4 gene also have a higher risk of cardiovascular disease or heart attack, vascular disease, because it also causes elevations in LDL-C, which is, quote, bad cholesterol. It's a really bad word, but we'll use it for the point of this podcast. And then ApoB, which is another metric for how sticky cholesterol particles are. So it leads to issues both peripherally in the heart and also centrally in the brain. And what's good for the heart is good for the brain. So regardless of if you have this gene or not, getting your cholesterol under control early is a really big deal, and something that most people who are young don't really want to think about because they don't want to take a medication.
Yeah, I'm gonna work on it. I'm on it.
Totally. I mean, I get it. I also feel like, well, can't I fix all of this with like my diet and exercise? Like, I'm young, I should be able to fix it. And unfortunately, there are some factors that are sometimes out of our control.
Right, like my LP little a.
Yes.
Right, I can't.
No, it's genetic, and I also have that. Like, thanks, parents, for
Thanks,
that.
Mom. I know it's my mom because she has it too.
Yeah, exactly.
Is ApoE4 genetic?
Yes.
Okay.
Yes, so that's a gene.
I was wondering that when you say gene, I'm like, so it is genetic.
Yes.
Got it. Okay,
Yes.
clearly didn't go to pre-med.
No, all good, and we're going to like simplify it for everyone listening because I'm out of my head sometimes.
So other than the ApoE4,
yeah.
are you looking for anything else specific in the blood panel?
For some people, we also will test certain Parkinson's genes.
Okay.
Not relevant necessarily in your particular situation, but for some people we do because that also will change things.
And is that if you have someone in your family with Parkinson's?
Yeah.
Okay.
Yep.
Who is coming to you? Like, I know obviously I came to you, but what are your typical clients saying? Are they experiencing certain things, or is it more just, oh, I know my parent or my grandparent had something and I want to get ahead of it, or is it a mix?
Yeah, there are 3 buckets, I would say, of people. One, they did a person who has done some sort of direct to consumer genetic test, like they did 23andMe when that existed. And they found out, they carry a high risk gene for either Parkinson's or Alzheimer's. And they're like, well, what the heck do I do now? People with a family history, that probably is the biggest bucket because, as you can imagine, having a loved one go through one of these diseases is horrific, and it is extremely motivating to not let that happen to you, especially if you have kids. You don't want your kids to experience, for example, what you had to experience if your mom went through this condition. So that's the biggest bucket. And then the third is people who have risk factors like you. For example, they've had many concussions and they're worried what they can do, or people who have experienced some subtle changes to cognition and they can't really tell, is this a sign of something more serious, or is it just because I'm really busy and distracted and going through hormonal shifts or whatever it is.
I want to unpack a few things in there. First, in terms of concussions, is there a correlation with concussion exposure to these diseases?
Yes, absolutely. And the more concussions you have, the higher your risk. So it's additive.
Okay.
And of course, the more severe the head injury is, the higher the risk. But even mild concussions or head injuries can increase our risk. And sometimes when we do brain imaging, we can actually see that there are little scars in the brain from these prior head injuries because they can cause really a shear force or trauma or tearing force on the small blood vessels, but also actually the brain cells themselves.
I'm actually very curious of doing brain imaging. That'll be our next thing we do.
Yeah.
Well, I know I said this to you, but even I think about my first concussion, which was potentially my worst one.
Yeah.
Where I landed on the back of my head because I thought I could do a back handspring on a cement, thinly carpeted floor in 6th grade. And I just dove onto my head. But I ended up with 2 black eyes because my brain literally hit the back of my head and the front of my head so freaking hard.
Yep.
And that is like terrifying to me now. Also just because I feel protective over that younger version of me.
Yes.
But it really showed me how much your brain is just rocking around in there and hitting things.
It's floating around in some fluid and it does shake, and we call that a coup counter coup, meaning like you hit the back and then you hit the it whips and hits the front.
Makes you want to throw up when I think
really
about it.
really scary.
Another one in terms of concussions, have you done any work with craniosacral therapy?
I haven't personally, but I do know about it.
I was just curious because I've seen great success with it during my recovery from my latest concussion. And I was curious if it was a part of any preventative nature or recommendation, or honestly, once you have one of these diseases, if they've found any benefit from it.
I don't know the answer to that.
I'd be curious. So with the concept of people coming to you with symptoms of
Right.
feeling like this is different,
Yeah.
are you also seeing a lot of new moms?
Oh, yes. Or moms that have, 3 or 4 kids that are just like running around like chickens without heads. Sorry.
Yeah.
Yeah, and there's this like thought like mommy brain. What the heck is mommy brain? Well, mommy brain is real. One, the brain changes during pregnancy. It rewires in probably a really impactful way. And impactful in the sense that mothers are actually at a lower risk of dementia compared to women who've never had a
Really?
baby. And that's one, likely related to the changes in the way that the brain cells are connecting that gives a little bit more of an insurance policy, we'll call it, against these changes that can occur with dementia pathology. But also the surges in hormones like estrogen seem to be really protective for the female brain. And we think that it may have something to do with
Interesting.
how women who've had babies are at a lower risk.
Fascinating. Is there, I feel in today's world, we are consuming so much and doing so much at one time. Are you noticing a lot of these people coming to you who, me, for example, like we did all of the tests. I don't have any of the risk markers. Is it just that we're trying to do too much at once and that's why our brain is not able to keep up with us?
It's a good question. So your situation is slightly different because we know about your neurodevelopmental past with your auditory processing issues as well as the ADHD and now the concussions. So I like to say that your brain is extremely resilient because you did really well on the cognitive test. You've really worked around a lot of those previous issues that you've had and found a way to really strive, which is awesome. The brain is so cool in that way. It can really work around injuries, and another reason why I love it so much and why I'm so passionate about this space. But just because it can do that, and because of your history, you're also a little bit more vulnerable to things that would otherwise maybe not affect someone else to the same degree. So, for example, when you're super stressed, when you haven't slept, like all those things might hit you a little bit harder cognitively than somebody else, just because you have these underlying susceptibilities or vulnerabilities.
Honestly, it's so comforting and reaffirming to hear that because I've always said that sleep is such a priority for me because I am deeply impacted by not having good sleep. Like my mental health plummets. I can't concentrate. I feel like an angsty bitch. Like I'm constantly on edge. It's why I stopped drinking, quite honestly, because it was the same type of thing.
Yeah.
And that just reaffirms that like I do know myself and that I'm not just making these things up.
Yeah, you have an amazing self-awareness of how your brain works. And honestly, stopping alcohol is probably one of the best decisions that you made because alcohol in excess is not great for
Let's talk about this.
risk. We know excessive alcohol use is a risk factor for
What
dementia.
is excessive?
For women, more than 1 drink per day.
Wow.
Or binge drinking.
Okay.
For men, that's more than 2 drinks per day, which, in the summer, like maybe some people are drinking that much. I mean, it is.
I was not even summer. I used to implement not drinking on Mondays because that was my way of not drinking every single day of the year.
Yeah, well,
and
there
I would
you go.
Absolutely have more than 1 drink a day.
And it's really common for people to be like, oh, I'm just going to like go home after work, have a glass of wine or something. Like a super common practice, but it's not great for long-term brain health. We understand that now. And especially if you have had risk factors like you do, ADHD, concussions, it's best to just avoid those sources of risk if you can, and especially people with high-risk genes.
And I know I asked you this. Are we seeing risks with certain drugs like cannabis or psilocybin?
So it's really interesting, and I love looking this stuff up. I love falling down rabbit holes, and ketamine is also the new craze. So I'm here reading and reading.
I'm curious about ketamine.
Okay, so let's talk about weed first.
Please don't tell me.
Okay, well, one of the challenges here is that a lot of the studies on long-term cannabis consumption are in people who've smoked cannabis,
Right.
which is a different delivery modality than most people are consuming it now, and like
Also,
edibles.
that just can't be good for your lungs.
Yes, and the other chemicals that are involved
Right.
with smoking are just a little different than what you're going to get in tinctures or edibles or whatever else. So there's that caveat. The real big part of this and what the studies clearly show are that when used while the brain is still developing, so that's under 25, especially in adolescence, it actually has been linked to smaller brain volumes in certain key regions involving memory, and also a higher risk of certain mental health issues like
Fascinating.
schizophrenia. But that risk it doesn't translate to adults.
Okay.
So in the short term,
I wasn't smoking, or I didn't do anything with weed at that age.
perfect.
So we are Gucci. But in the short term,
we know that for up to 48 hours, weed can impact your processing speed, your psychomotor.
48 hours.
48 hours. Yes.
Is that after a certain amount, or that you don't know?
I don't know.
Yeah.
That's just how long it can linger in terms of the
Interesting.
cognitive effects.
Okay.
It can, of course, cause issues with learning new information, issues with short-term memory, recalling that information, and then the big one is processing speed, how quickly you're able to.
Yeah.
Like
That
you
makes
could
sense.
you can
Yeah.
tell. But the good news is that upon cessation, those don't actually seem to be long lasting impacts. At least that's what we know now. I mean, now it's a lot, use is so much more common now. I think we'll have better
I hope
studies.
So. We need a lot more studies.
We need a lot more
about,
studies.
around breastfeeding, around pregnancy,
Yes.
all of those things.
Yes.
What about, and I'm also specifically curious around cannabis and the relationship with the brain, because as someone with ADHD, when I am not even high, but when I have some cannabis in my system, that is the only time my brain is quiet.
So-
where it's not constantly
Yeah.
going in 100 different places.
So, that also brings up another really interesting point about cannabis. Cannabis, and specifically CBD, are actually used to treat certain neurological conditions. Pain, of course, but also epilepsy. Kids can be put on a certain cannabinoid to treat seizures that just don't go away.
We had someone on here talk about that.
Okay, there you go. So, it probably also matters the ratios of the THC to the CBD. And there are versions of like edibles and tinctures that you can buy that have a much higher CBD to THC ratio. And that actually might be better for using it more medicinally as opposed to just getting the leisure, like fun recreation out of it.
And what about psilocybin and ketamine?
Yeah, so psilocybin, again, not any significant data that shows that there's any long-term harm in terms of risk for cognitive decline or neurodegenerative disease. Actually, the studies are pretty impressive in terms of the power of it for mental health, for trauma specifically. So when used appropriately, under the guide of someone
Intentionally.
who really knows what they're doing, it can be a really, really powerful substance to help. So long term, doesn't seem like it's impacting. And of course, in the 70s, there was a big kibosh on psilocybin. So we really missed out on getting some good quality information there. But it's coming back.
I think it's coming back.
And we'll have more data there too. And then the other one, again, is ketamine. And a lot less is known about ketamine. We know in the short term, again, it can impact memory, learning, kind of similar to marijuana. But long term, again, nothing's really showing any long term trauma. The biggest problem is really alcohol.
Yeah, which is, I mean, I could get on my soapbox about this, but that's what fascinates me, in the sense that this country specifically has pushed alcohol as this thing that's legal and fun, and you're judged almost if you don't do it. And these drugs that aren't showing these negative lasting impacts, and some are even showing positive impacts, are the things that are illegal
Yes.
and judged.
Yes.
And it's very interesting. I also just I'm always curious because when we were young, it was the era of like drugs are taking an ice cream scoop out of your brain every time you take them.
Dare.
Literally. It was like or the egg on the pan. This is your brain on drugs.
I was literally terrified of drugs my whole life. Like terrified.
I didn't touch one in college.
They scared the shit out of me.
I used to judge, and I mean, I had a very judgmental relationship specifically around Coke. I was like, you are horrible if you are doing that.
Well, that one is probably not good. So
yeah, I'm not saying that's
no. That one has some long-term problems. So we should be a little bit more specific when we talk about drugs.
Yes.
There are some sort of drugs that are probably not as bad as we once were told, and then there are others that really can cause some serious long-term harms.
In terms of prevention, if someone takes this test with you, like I did, and I don't have any risk factors, should I still be doing preventative things?
Yeah, so prevention is for everyone.
Okay.
Everyone with a brain is at risk for one of these diseases. You just don't know what's going to happen later in life. But in someone who has low risk factors, doing things that are really simple and easy to incorporate into your daily life is what I would recommend. So,
I want to get into those.
Yeah, thinking more about the way that you eating, and defining really what a healthy diet is. When we think about the best brain healthy diet, we're really thinking about a more Mediterranean based diet. So diet that's rich in fatty fish, extra virgin olive oil is the main oil, lots of fruits and vegetables, limited processed carbs and refined carbs, processed foods, and so forth. Like that is also a really sustainable diet for a lot of people. Lamb is okay. Some red meat once a week is okay, but really trying not to go in excess there. That's something that you can adapt early on, and it isn't necessarily it shouldn't be a huge lift.
Right.
Of course, there are exceptions. We're all going to go out to eat, and we're going to go to specific events, and we won't be able to control that. But the times when we can, I really advocate for taking at least small steps towards getting a more Mediterranean diet. And if you're starting from someplace that's so far from that, like start with adding, a serving of fatty fish a week. Just starting small and working towards that.
You mentioned blueberries earlier.
Yeah.
Is that a food we should also be trying
Blueberries
to incorporate?
are a superfood after, I made that comment.
Okay.
But I do tell people to eat blueberries.
I have them in my smoothie every morning.
It is true, but there's so much more than just, eating blueberries. Duh.
Also, olive oil. I heard somewhere about like taking a shot of olive oil every day.
Yeah.
Is this something we should actually be doing?
So extra virgin olive oil is an extremely powerful anti-inflammatory. It also seems to impact the pathology that's related to Alzheimer's disease, specifically tau pathology, which is one of these proteins that's involved with Alzheimer's disease. For you, I wouldn't say that you need to take a shot of olive oil, extra virgin olive oil every day. But for some people that have high risk, I do suggest that they take a tablespoon or two a day. Okay. But for you, just have a nice salad with it on it. Find a way to incorporate it into just your diet.
I do love olive oil. What other preventative measures can we all be taking?
Yeah. So, and on this idea of like fish, a lot of people, either for ethical reasons or just they don't enjoy fish, have very low omega-3 levels in their blood when we check. I say that's one of the most common findings.
Mine was low.
Yeah, that's one of the most common findings because it is really difficult to eat enough omega-3 fatty acids. These come from primarily fatty fish, so tuna, mackerel, lake trout, salmon. They can come from some plant-based sources like chia seeds and flax seeds, but it's much harder for our bodies to absorb omegas from plants. So really the fatty fish are the primary. So for a lot of people, if there aren't any medical contraindications, I really suggest that they take an omega-3 supplement to get enough omega-3s. That's something that you can start earlier on in life.
I just ordered mine.
Great.
Subscription from the link you sent me.
Amazing. Perfect. And that's something that I do every single night. It's easy. It takes I actually have a pill box, by the way, like a granny.
Joe and I both do. Are you
okay,
kidding me?
Perfect. I love
Joe's
that.
way better about filling it. Like he is so anal. Like on
Perfect.
Sundays, he's filling out his whole thing. Yeah.
Yeah.
But I do too, mainly so that I just can grab it when I travel. 'Cause
Exactly.
especially if it's summer, we're going to the beach every weekend. I just grab it, I throw it in my bag. I know it has my ADHD medication, my antidepressants, like all of those
And
things.
now you'll put your supplements in
Yes.
there. So yeah, I fill it every 2 weeks. I put it by my bed, and then I remember like, okay, yeah, here's the day I have to take my supplements. And it's so easy. Like it takes no time out of your day.
Are there other supplements? I know obviously supplements are so specific based on blood
Yeah.
work,
Yeah.
but are there ones that you could recommend getting your blood test done to see if you're low on?
Yeah. So the other two big ones, especially in people that are younger, vitamin D and vitamin B12 are ones that are common deficiencies and ones that do have a link to long-term brain health. So a lot of people end up needing a vitamin D or a B12 or a B complex
We
vitamin.
added to mine.
Yeah, exactly.
And then what about exercise? Big one.
Huge.
Okay.
Exercise might be the most important lever to pull for health collectively. And what does exercise mean?
Yeah, that was my next question.
Like, how do we define exercise? How, like, do we need cardio? Do we need strength training? Like, what do we need? We don't have perfect answers. That's the truth. The optimal type, duration, dose, not fully established for the brain, but we know we need a combination of cardio training and strength or resistance work. It doesn't necessarily have to be intense, but I do tell people to try to like walk around, move if you aren't able to get to the gym, like do something active. Like the time that you spent doing active work and not sitting in front of a desk is good for you.
And what about frequency?
Yeah. So, I mean, it's very, very person dependent on
Yep.
what someone's body composition looks like. Women tend to skimp out on the strength and resistance training. To share a personal story, I recently did a DEXA scan and was so sad when I found out that, you know, I was doing forever so much what I thought was great strength and resistance work with like my 10 to 12 pound weights that I
Yep.
was doing tons of reps with in different classes. And you know, I was doing this for years and like it didn't help my body composition or me put on muscle mass. Like we actually need to lift heavy things, and that's not something that a lot of women feel comfortable doing.
Yeah, I feel like it's changing now. It's becoming
Yeah.
a little bit more of a focus.
Yeah, so I'm on my own personal mission
Yeah.
to lift heavier weights, and I'm trying and I'm getting stronger. I'm proud of myself.
I'm so proud of you.
Thank you.
But I do want to get back into strength training as well.
I love this for you to get stronger, because the other thing that happens, and for you in particular, you're not going to think about this now, but your risk of falling when older
Yep.
is really important for you, because the last thing that you need is another concussion.
Yeah.
We don't need another compounded injury. And I always say that fall prevention is neurodegenerative disease prevention. And who's thinking about falls at the age of 30? Like, not a lot of people, but it is really important. And one way to reduce our risk of falls is to have more muscle mass, because that's really what's keeping you stable, upright. And if you do fall down, it's what's helping you get back up.
Yeah. No, this is actually top of conversation in my house right now because
Great.
of my mom with like osteoporosis and
Yes.
bone density. So it's something we are talking about very often.
Yes.
What are some other things? What about like brain games, like a
Yeah.
Sudoku or a Wordle or any of those things? Are you seeing those? Is that actually helping? or you
People
don't
love
know?
doing them. So
Yeah.
if you love doing them and you're having a great time, I'm not going to stop you from doing them. But if you just keep doing that, you're going to become really great at that. And it's not really adding any novelty or
Okay.
neuroplasticity. You're not really getting brain gains from it. My recommendation is to, and again, personal based on what you already do, but really just diversify your experiences. Like I mentioned to you, it's so great that you have so many diverse people on your podcast that you're learning from and conversing with. And that really, that kind of engagement is awesome for the brain. It's,
Right.
yes, social engagement, but it's also making you think in different ways, which is so powerful. A way that you can do that throughout or without needing to have a podcast platform is leisure reading and picking novels with different writing styles and different genres.
That's my issue.
Yeah.
I
like-
read every night, but it's basically the same book, copy and paste.
Yeah. I mean, me reading medical journals is doing absolutely nothing for
Or
my,
we're reading very different things.
but it's the same idea.
Okay, so I need to diversify
Yeah.
my style of reading.
Yeah. Pick different types of literature.
Okay.
And like, you know, I think it's a great way because it also helps you calm down before bed. If you read 10 to 15 minutes before bed, better than being on your phone. Like another really simple strategy that I think helps chill out and also helps your brain.
We read every single night, and I joke because our older son was having a hard time sleeping and falling asleep, so we got him this like little thing called a Yodo, and it basically plays audiobooks.
Oh, I love it.
And I was saying to my friend, of course it's helping him, because if you put me in bed without my Kindle, I would throw a fit. I can't fall asleep without my Kindle. Like,
perfect.
Straight up on The Bachelorette, I was just on every night. We get in bed, I'm still reading for 15 minutes. I need it.
Yeah.
It helps me so much.
Yeah.
What about journaling?
Yeah, so journaling is a really good strategy, especially for people who say, and I think you mentioned this, that, you know, some memories just don't stick for me.
Don't have them.
Like someone, you know, we had this experience a couple of years ago and I have no real recollection of this, and everyone around me remembers it. Well, our brain is a little bit predictable in how it learns information, and everyone learns information in a different way. There are ways to support our brain's ability to learn new information, and those things may seem obvious or things that you might have picked up on your own. For example, if you're trying to learn new information, repeating it over and over again, of course, it's going to stick more likely. But writing things down is also a really, really strong encoding strategy or learning strategy. So journaling about your day, your experience is therapeutic, stress relieving, which we all need these days, but also it's a really great way for your brain to kind of reinforce the experiences that you've had and form stronger, longer lasting memories.
Right. Well, shout out Quiet Your Mind and Busy Your Hands, my journal, an adult coloring affirmation book that I will be sending you. I forgot to bring you one today.
Thank you.
But honestly, that was one of the reasons why I journaled in the first place. I started journaling after my concussion, and then it's what led to me wanting to create this product. And then you mentioned sleep. How important is sleep?
Sleep is so key. In fact, there was a study that actually showed that if you exercised while you were sleep deficient, that the benefits of the exercise didn't exist. So you really, really need good sleep to reap the benefits of everything else in your life. Sleep is where we consolidate our memories. We process all the information, our emotions from the day. It's so critical. It's also where we clear these toxic proteins that are related to Alzheimer's and Parkinson's from our brain. So yes, getting enough sleep is important.
What is enough?
That's a personal answer.
How do we know, though?
Do you feel well rested in the morning? That's the best gauge. Like, you can buy fancy trackers that'll tell you how much REM and deep sleep and total and all that stuff.
For the most part, I think I do.
Yeah.
I'm like pretty consistent 7.5 hours.
And if you feel really well rested at 7.5 hours, perfect. Some people need 8.5. Some people are great after 6.5. So sleep duration is really personal. Most people, though, do need more than 6 hours of sleep.
I can't do under 6. No way.
Most people do. And there are studies that show that getting less than 6 hours of sleep consistently doubles your risk of dying, period. Yeah. Also, of course, increases your risk for dementia. So it is super critical to get enough sleep, but also just the quality of your sleep.
Yeah.
A lot of people turn towards a nice nightcap,
That's what I was gonna ask.
Booze right before bed, and it helps them fall asleep, but it really severely impacts the quality of sleep. Even if you don't notice that it absolutely is. You aren't getting the different sleep stages that you need to get restorative sleep. Or other people will turn towards their medicine cabinet and take things like Tylenol PM or Unison, lots of things that are over the counter.
Unisome addiction was real during pregnancy.
There you go.
It was the only way I could sleep, though. What about melatonin? Same thing?
Melatonin is a natural hormone, and in short bursts, such as if you're jet lagged or if you do really need something as a one-off, it can be a good, relatively safe solution. It's just not something that you should be taking every single night. If you're having a hard time sleeping, get to the bottom of really why that is, instead of turning towards supplements and a medicine cabinet.
And what about magnesium?
Yeah. I mean, again, magnesium can be really helpful for some people for getting to sleep. response is really variable. It also may be good for long-term brain health. We don't really have a ton of studies that are so strong, but it might also help with short-term cognitive function, like our attention, concentration, processing.
And what is the relationship, if there is one, between these diseases and mental health?
Oh, there absolutely is one. We know that depression is a risk factor for Parkinson's, for Alzheimer's disease. And treating depression early seems to impact someone's risk down the line. We also know that these diseases themselves can lead to mental health issues like anxiety and depression. But more on the prevention space. Things like bipolar and schizophrenia sometimes are seen more related to the Parkinson's spectrum of diseases. There may be some genetic link or overlap there that really explains that finding. But treating mental health is really important, and there's so much stigma around it, and getting medications to you or taking medications if you need them is don't be afraid to do that. Like, so many people are like, oh,
truly,
I don't want to take something. I'm fine. I'm stronger than that. And it's not about being strong. It's really about like treating your health collectively, and letting mental health go unchecked is just such a missed opportunity.
Such a missed opportunity. And I think many people struggle because it's an invisible, not disease, but an invisible ailment, because you can't see it. But if you had a broken arm, you wouldn't just walk around and be like, it'll fix itself. You would get a cast.
Yeah. And it's so important to recognize that it's not like, it's no one's fault. It's truly changes in brain chemistry and neurotransmitter levels. And that is a medical condition that we can treat.
I read that we're seeing these diseases much more in females. Why do you think that is?
Yeah, so Alzheimer's specifically is more common in women.
Okay.
And there are lots of thoughts about why this may be the case. One leading thought is related to the changes that happen to women in midlife around menopause. There's this really steep decline in female reproductive hormones, specifically estrogen. And as I mentioned earlier, estrogen seems to be protective for the brain. And that steep decline it's happening so quickly. We get other symptoms like hot flashes, mood changes, but also our brain isn't able to adapt to that quick of a drop off. And that seems to potentially trigger the neurodegenerative process. That said, there's also a lot of other changes that women go through during that time. Our body compositions change. We have higher cholesterol during that time. Our metabolic health is also impacted, and all of those are risk factors as well. And there may be specific genes that are related to our X chromosome that put us at a higher risk for depositing these abnormal proteins.
Yeah, I'm terrified of menopause, to be honest.
I know.
Are we seeing a benefit of hormone replacement therapy with these risks?
Yeah, and there's a huge shifting mindset around this, which is a really, really exciting time for women and for us specifically.
I know. My mom and I have been talking about it a ton because she wasn't offered it, and she's angry.
Yes. And most women, they should be angry because there was a lot of medical misinformation, and doctors in training, myself included, were told that these hormones are really bad for women, and they cause breast cancer and stroke, and they cause dementia. And that's because the hormones that were being studied were not actually bioidentical hormones that we use today. So we're very fortunate because by the time that we're going through those changes, we're going to have a lot easier access to hormone replacement therapy. And it does seem to make a huge difference in terms of acutely, women sleep better on it, their cognition is better, and then long term, it does seem to be actually associated with a lower risk of dementia if used at the right time.
Yeah, I've had a lot of women in my DMs telling me about their experience with it who were maybe like early 40s versus having the conversation with my mom where she's now dealing with osteoporosis because she thinks a part of the reason why is because she wasn't offered it.
Yeah. I mean, hormones also help so many other parts of our health. Bone health is one of them.
Yeah. I want to finish by doing some fast questions.
Ooh, okay.
What is your favorite brain activity?
Ooh, I think movement, truly. I know it's so lame, but like just getting out, walking my dog, spending some time in nature seeing the green flowers, the trees, like that kind of stuff is a time for me to get activity and just kind of disconnect from the world.
Yes. What is one supplement that you swear by?
Omega-3s.
Okay. What's one daily habit that seems small but makes a huge difference?
Going to bed at the same time every day.
Ooh. What time do you go to bed?
Around 10.
Yeah, same. I try.
Yeah, I try.
Yeah.
And that does make a big difference.
Favorite food to eat for brain health?
Ooh, we can't say blueberries. That would be really, really.
Yes, you can. Yes, you can.
Let's go with blueberries.
Okay. If you could put a sticky note on every woman's mirror, what would it say?
Ooh. Think about your brain health today.
I love that. The thing you're most proud of with the work you're doing?
That I'm actually pioneering a space for people that are younger to take action and take ownership and control the future of their brain health.
Yeah, give this girl a Nobel Peace Prize. What is more brain numbing, reality TV or TikTok scrolling?
Ooh, TikTok scrolling.
Is it bad for us? You can be honest.
You know why I think it's really bad? Because it also not only is brain rot, which so is reality TV, but like who doesn't love that? It's more that you're like holding something, looking down, like positioning yourself in such like an unnatural way. You're limiting visual inputs because you're like so focused on exactly what's in front of you. You're not getting any peripheral vision, which is super important for the brain. We didn't talk about it, but it is. And you're just like hunched over, changing the way you're breathing. I just think it's so bad for us to be on our phones all the time, and people are walking on the streets like doing this. Like, look up, people.
Yeah,
look up.
Those dumb people. Is it, I actually have so many more questions on this exact thing. Is it also because I know personally I feel when I'm scrolling that it's the constant change? It's like dopamine hit, dopamine hit, dopamine hit, dopamine hit. Like that, I just feel like that can't be good for us.
Yeah. I mean, there are people who wrote about this. There's like a book on this specifically.
Why is peripheral vision so important for us?
So we do know visual health is related to brain health, and it's a modifiable risk factor for dementia. When we think about it, we think about visual acuity, but the way the brain works is very use it or lose it. So it needs a lot of sensory activation to keep it healthy and happy. And when you deprive it of getting that sensory input, whether that's through, focusing so intensely on one thing that you are really limiting what you see in your periphery, hearing loss, for example, not being able to hear and process, like those things are impacting directly certain regions of the brain that are related to these processes. So really try to get out there. Like, that's why I said my favorite thing to do is nature walk with my dog, like not with my phone. Like, I try to tell people do not bother me, or I'll leave my phone at home, just because like taking in your surroundings is just so critical for us.
And is reality TV or quote unquote brain rot, like, is that actually having a negative impact on our brain?
I don't know, but I'm definitely not innocent here. It's one of my favorite things to do.
It's a later in life obsession for me.
I'm obsessed.
What do you watch?
I mean, anything.
So you're really, I have two shows.
Okay. Tell
me.
me.
Summer House was my first foray into Bravo.
Okay.
And now I'm on my first season of watching Love Island.
Okay. I mean, I watched some. I feel like I'm embarrassed to even like say.
Don't be. It's a safe space. But I feel like it can't actually have a negative impact on our brain, because why is that different than just watching a different TV show?
No, TV period. Like, if you're going to pick a cognitively stimulating activity, TV's not one of them. But,
Fair.
But
we can't always be stimulating ourselves.
No, everyone needs a time to calm down. That's why I'm not saying don't do it. Everyone needs to find a thing that's just like, okay, I need a moment to breathe, and like no judgment there.
Those are honestly mainly my smut novels. Wait, now I need to know, what is your favorite reality TV show?
Okay, so we got into like really like gross Netflix TV shows, like
what?
Too Hot to Handle,
Yeah,
and I was like,
people love that.
I was like, God, I shouldn't even say it, but like the people on this show, like it's just a different level, you know, like it just takes you to a different brain space. And sometimes when you're doing things that are so intense all the time, like all you need is mindlessness.
You need to rot. You need to rot. I am a full proponent of rotting. I actually have a career coach, and on my agenda is like once a week working in a space where I can also rot, like allowing myself to just rot a little bit.
No, it is important, and we should acknowledge that. Like we're so high strung, and we're always doing things that are great. Like taking time to just do absolutely nothing, like take your brain to the playground.
So important.
Is important.
So important. I love that. Take your brain to the playground. That's what I'm gonna call it at night. When I'm like, Jill, let's watch Love Island. I got to take this brain to the playground. Thank you so much for coming on. Where is the best place people can support you?
Yeah. So follow me on Instagram, Dr. Kellyann Niotis. I'm posting a lot. A lot of it is really sciencey, so if you're a nerd like me, you'll find a lot of enjoyment out there. My website too, drkellyanniotis.com, and hopefully you'll be hearing more from me soon, and we'll have an exciting announcement.
Are you taking new patients right now?
Yes.
Okay, great. So send her an email. Thank you so much for coming on here. I was so happy to be rekindled.
This was so fun.